You have learned about stress dosing and how to manage an illness when your child is ill and is able to take their hydrocortisone orally or by mouth. However, if your child is vomiting, having diarrhea, and cannot keep their medication down, they will need to have an intramuscular injection of hydrocortisone. I'm going to show you how to prepare and give a Solucortef injection. Solucortef is injectable hydrocortisone. Your child will need this injection if they are vomiting, having diarrhea, or if they suffer a serious injury such as a broken bone and are not able to swallow pills. They will also need the injection if they are unconscious or not waking and responding to you normally. You have been provided a kit by your endocrine nurse. Everything you need to give the injection is in your kit. If you don't have a kit, please contact your endocrinology clinic. You will need these supplies from your emergency injection bag: 23 gauge 1-inch intramuscular needle, or 25 gauge 5/8 of an inch intramuscular needle, a 5 ml syringe, or a 3 ml syringe. You will need 2 chlorhexidine or alcohol wipes, 1 sterile gauze, and 1 Band-Aid. The medication will be the Solucortef Activial 100 mg in 2 ml preparation with the yellow cap, or Solucortef Activial 250 mg in 2 ml preparation with the red cap. I recommend that you always have 2 Activials in your kit at all times. For today's demonstration, the amount to be given will be 100 mg in 2 ml. Check the expiry date once a year and examine the vial for damage before using it. You will see that there is powder in the bottom chamber of the vial and liquid on the top, separated by a rubber stopper. It is important to keep the vial at room temperature. Do not leave it in your car or anywhere it could become very hot or very cold. To prepare the injection, thoroughly clean the area where you will be preparing your injection. Wash your hands well. If you are traveling and unable to find soap and water, keep a small bottle of hand sanitizer in your kit. Firmly press down on top of the Activial to force the diluent, which is the clear liquid, from the top compartment into the lower compartment and onto the powder. Sometimes the rubber stopper gets stuck. If this happens, you can tap it against your palm or the side of the table. If it doesn't move, use the second vial. Gently rotate or swirl the Activial to mix the liquid and the powder and ensure there are no white, unmixed lumps. It is important not to shake the medication. The powder could get stuck at the top of the vial and it may not mix thoroughly. Once you have swirled the Activial, let the solution sit for 1 minute until it becomes clear. Remove the small plastic tab covering the center of the stopper and cleanse with one of the alcohol wipes. Now we will attach the needle to the syringe, ensuring that both pieces remain sterile when they are connected to each other. This is the sterile end of the needle. Don't touch this with your fingers. There are 2 options for doing this. Option number 1. Peel the needle package like a banana, holding the paper down with your non-dominant hand. Peel the syringe package like a banana. Option number 2. Peel the syringe package like a banana. Peel the needle package like a banana, holding the paper down with your non-dominant hand, and twist it into the needle until it stops. Now your needle is safe and secure. Look at your medication to make sure that it's clear and there are no chunks. There will be a bit of foam at the top, and this is normal. Open your gauze by peeling it apart, being careful to keep your fingers to the outside edges of the package. Remove the cap of the needle by grasping the cap at the very end and carefully pulling it off and placing it in the clean area of your gauze. Putting your cap somewhere clean, like an open package or on your gauze, keeps it clean for replacing it later back on the needle. Insert or push the needle through the center of the stopper. It is easier to do this on a firm surface. Invert the vial or turn upside down and withdraw the dose of medication slowly. Pull back on your plunger until you get to the correct dose. This often takes some manipulation of the vial to get all the medication out. If the medication level is low and the needle is above the liquid level, you'll see that you will be getting air and not medication in your syringe. You just have to pull the vial up so that the needle is under the level of the liquid and continue pulling back on the plunger to get the rest of the medication out. It is important to notice the difference between the medication and the air bubbles. Don't let the air take place of the medication. The air will not harm you, but it will not be helpful if it is replacing the medication. Tiny air bubbles are actually smaller than they appear, and these are not significant. Pull back on the plunger until you reach the appropriate amount. You are looking for the black line to be leveled with the 2. Push the air out of the syringe to ensure your dose is only the medication. This may take a few tries to complete, but remember, these are small air bubbles and they are not significant. If you get a bit more or less than 2, don't worry about it. If you have reached the 2 and there are no air bubbles left, you may remove the needle from the vial. If there are still bubbles remaining, you just have to flick it and then push the air out with the syringe. Carefully place your cap back on the needle to protect it from contamination. You're now ready to give the injection to your child. Position your child so the largest part of the thigh is exposed. Clean the skin in a circular motion with one of the wipes as you were shown. Use the alcohol swab in a circle and make larger circles as you go. Make the circle larger than you need so you don't have to worry about where you cleaned. Ensure that you have let it dry. The drying process is what cleans the skin. Do not blow on the area, touch the area, or clean back and forth. Remove the cap from the needle by grasping the end and pulling it off carefully. Hold the injection in your dominant hand and support the skin on the leg with the other. Quickly insert the needle at a 90-degree angle. Inject the medication at an even rate. This will take less than 30 seconds. If you feel unsteady, you may take your fingers of your opposite hand to hold the needle still. If you are able, count to 5 before removing the needle to ensure the medication remains in the body and doesn't leak out. Withdraw the needle rapidly and use the sterile gauze to apply pressure to the injection site. It is normal for it to bleed. You can also apply a Band-Aid. As instructed, with your thumb, slide your thumb to the push tab on the needle cover and push to close the end of the needle. You can place the needle in a sharps container or a solid plastic container for disposal. The effects of Solucortef will last about 6 hours. This will give you time to seek medical attention. If you have given the injection, please contact the endocrinologist on call to determine if you need to come to hospital. If your child is unresponsive or unconscious, please contact 911 for an ambulance.